Pregnancy-related pelvic girdle pain, or PGP, is more than just a nuisance. It interferes with essential daily activities such as sitting, standing, sleeping, walking, and transitioning between different positions. My name is Lu Yao. I'm a physiotherapist and a proponent of evidence-based practice. Today, I would like to share with you on what I know about pregnancy-related pelvic girdle pain from the physiotherapy point of view. In today's presentation, I would like to talk about what is pregnancy-related PGP, why it happens, what does it feel like, the underlying pain science, and how can physio help. In the end of this presentation, I would also like to give you some general physio recommendations that might help prevent or reduce symptoms of PGP. First, what is pregnancy-related PGP? It is pain experienced on the low back, buttock or outside of the hips, pubic area and inner thigh, and sometimes tailbone, during and or after pregnancy. But even before that, what is the pelvic girdle? The pelvic girdle, or the pelvis, consists of two hip bones hugging the coccyx and the sacrum in the back. In the front, they join together at the pubis symphysis joint, which is a strong fibrotic joint with little to no movement. The sacrum and the hip bones connect to form the sacroiliac joint, or SI joint. This whole structure together forms the pelvic girdle. Girdle simply means belt in Old English and German. PGP is the most frequently experienced on the joints of this belt, namely the SI joint on the buttock or the pubis symphysis joint in the groin area. The pelvic girdle and the pelvic floor muscles are also responsible of holding the pelvic organs in place. In women, these organs include the bladder, the uterus, and the rectum. There are also strong ligaments attaching and supporting these organs on the nearby muscles and bones. During pregnancy, as the baby is developing in the uterus, the weight on the pelvic girdle and the supporting ligaments increases, which can be a potential cause of pelvic girdle pain. We will unpack this a little bit further when we talk about the causes. Outside of the pelvic girdle, muscles on the hip and the back provide support for the hip and the SI joints, as well as allowing movement of these joints. The pelvic floor muscles provide support of the pelvic organs and control the passaging of the contents. There are also thick and strong ligaments over the sacroiliac joint to provide further support of the SI joint. It has been shown that these ligaments tend to be sensitized and become tender to touch in individuals with PGP. The prevalence of pregnancy-related PGP is estimated to be between 16 to 25%, and the ratio of PGP persisting into 2 years after childbirth is between 5 to 8%. So what causes PGP and why does it happen during pregnancy? The exact cause has not been clearly established. However, the cause is believed to be multifactorial, including hormonal, biomechanical, traumatic, metabolic, genetic, and so on. It should come as no surprise that the main biomechanical factor of PGP is the rapid weight gain happening between the second and the third trimester. This significantly changes the posture, weight distribution on the pelvic joints and ligaments, as we've mentioned before. These weight distribution changes can lead to altered muscle strategies during static postures and the various movements. All of these changes can often lead to the sensation of something is out of place on the pelvic girdle, which is common during normal pregnancies. The main hormonal contributor is believed to be relaxin, which is a hormone secreted by pregnant women to relax joints and ligaments in order to accommodate the development and delivery of the baby. However, a few studies have shown that the level of relaxin is not directly correlated to the severity of PGP. This further demonstrates that PGP is not a single cause condition. So, what are the other possible factors? A few studies have found history of low back pain, or PGP, history of multiple childbirths, previous fallopian tube inflammation or sapingitis, physically and psychologically demanding working conditions, perceived lack of support, reduced quality of life, reduced activity participation, lack of belief in improvement can all contribute to increased incidence and severity of PGP. Secondary consequences of PGP include poor sleep, protective muscle tones and stiffness over the painful joints, lowered pain threshold, reduced ability to carry on normal activities. I mention this because these secondary consequences can also worsen PGP, because stress, fear, pain tend to feed each other. Knowledge can reduce fear, which in turn can reduce pain. Therefore, this is a good segue into the topic of the pain science of PGP. Modern science has clarified many misconceptions about pain. It turns out pain is not a sensory input, but an output experience. As one of the famous pain scientists and Australian physiotherapist, David Butler, once said in his book, pain is like a baked pie, the taste depending on the ingredients and the way of cooking. Essentially, pain is the overall output resulted from a mixture of sensory input, perception, feelings, thoughts, and behaviors. A few studies have revealed that psychosocial factors, such as work and life stress, concerns of health and baby development, perception of support, quality of life, concerns of delivery pain, avoiding physical exercise due to fear of pain can all contribute to pregnancy-related PGP. Life is not simple during pregnancy. There are so many things to think about and work on: diet, exercise, mental health, work-life changes, planning baby rooms, tests and appointments, choices of delivery approaches, finding trustworthy healthcare professionals. Additionally, there is also stress about trying to reduce stress. It can be very overwhelming. Therefore, it is quite understandable that in pregnant women, the body is ultra aware and concerned of any change, especially in the pelvic area where the baby is developing. Concerns and worries can lead to increased stress hormones, muscle tension, and reduced physical activity. These can then negatively feed back to the psychosocial burden and the output pain experience of PGP. I realize that this presentation is probably adding more stress to you right now if you're pregnant and have PGP. But I hope the knowledge and information I share with you can ultimately reduce fear and pain by the time you finish this presentation. So, is there a way out of this negative feedback loop? The answer is yes. Modern pain science has discovered that just like things that will increase worries and fear can increase pain, things that increase safety and sense of control can help decrease pain. DIMS and SIMS. DIMS stands for dangers in me, which increases pain, and SIMS stands for safety in me, which decreases pain. Worries and fears and avoiding physical activities are DIMS. So where do we find SIMS? Generally, safety in me can be found when getting proper information about the pain and the causes, which is what we're doing right now. Safety in me can also be found in learning how to manage symptoms, getting more social support, finding good healthcare professionals, believing positive outcomes. But more importantly, SIMS is finding ways to continue to laugh, enjoy life, and carry on normal activities. How does one know how much the psychosocial factors are contributing to the pain? A few validated questionnaires have been developed in order to answer this question scientifically, which you might be asked to fill out at your physiotherapy intake sessions. So, how can physiotherapy help with PGP? Your physio can help you understand what might be the main contributors of the condition, identify what are the aggravators, and how to manage them. Your physio can also give you home exercises to take control of your symptoms and recovery. In the 90s, Dutch researchers Snyder and Vlaming coined the terms force closure and form closure of the sacroiliac joints. Force closure is the compression of the pelvic girdle joints by muscle forces. Form closure is the compression of the joints through the shapes of the joint surfaces. Many believe that insufficient and asymmetrical closure or compression of the joints can lead to increased muscle pain and sensitivity on the joints and ligaments, whereas sufficient joint compression can send feedback signals to tell the brain that the joint function is normal, hence reducing excessive tone and pain sensitivity on the pelvic girdle. This is one of the guiding principles used by physiotherapists in addressing pregnancy-related PGP by finding ways to sufficiently load the hip, SI, and the pubis symphysis joints. They do this mainly through strengthening and balancing the muscles around the pelvic girdle and optimizing body positions in static posture and movements in order to minimize symptoms and maximize function and confidence. At your first visit, you'll be asked various questions about the history and the current situation of your pain. Physical examination will be performed to rule out other possible diagnoses and determine the severity of your condition. Psychosocial factors will be assessed with questionnaires, as mentioned before. A treatment plan is usually given at the end of the first visit. A typical course of physiotherapy assessment and treatment for pregnancy-related PGP is around 3 to 4 visits. In terms of treatment, your physio will work with you to find the best home exercise programs and coping strategies according to your needs. They will also identify if there's a need to refer to other healthcare professionals such as medical doctors, occupational therapists, massage therapist, or a counselor. Now, I would like to share with you 5 general messages and recommendations about pregnancy-related PGP. 1. The feeling of something is out is common. During a normal pregnancy, the body undergoes continuous changes. Therefore, the body perception of joint positions and muscle patterns often change. Significant damage to the pelvic girdle joints from pregnancy alone is very rare. Partial or full dislocation of these joints are almost impossible without high speed and impact accidents, such as motor vehicle accidents. 2. More than 90% of pregnancy-related PGP have complete recovery. The pelvic and hip joints are strong and robust. Therefore, it is safe to do most regular activities that you always do up until very end of the pregnancy. An easy way to judge is that if the activities does not cause increasing or long-lasting pain, pins and needles, numbness, significant muscle weakness, it is okay to do them. If you're in doubt, ask a physiotherapist. 3. If vaginal delivery is your choice of delivery, a few large-scale studies have shown that it is safe even if you have PGP. Vaginal delivery does not appear to worsen or prolong pelvic girdle pain in these studies. This is potentially because vaginal deliveries tend to have faster physical recovery when compared to C-section, and sooner return to normal activities can help recovery. However, this is not a recommendation for vaginal delivery for every pregnant woman. You should always consult your doctor to weigh the pros and cons, then decide what's best for you. 4. If you have been physically active, there's no need to stop because it won't increase your chance of getting PGP. However, being physically active does not make you immune to PGP. Nonetheless, it does reduce severity and increase your ability to carry on daily activities. 5. There's a simple glute trick can eliminate pain instantly during rolling and getting in and out of bed, which is a common trigger of PGP. The trick here is to log row using your glutes to initiate the turn instead of using your upper body. What do I mean by that? Let's see a video of the normal way and the glute way. This is how you normally would get out of bed. This is how you normally would get into bed. Probably not like a dead bug like me. In the glute way, I straighten my outside leg first, push through my heel to log row, and pivot my body by throwing down my legs and the push up with my arms at the same time. And the same way getting back into the bed, just reverse the process. Push through the heel, log row the body. Lastly, I would like to recommend the Ross Mama Move app. It's available on Android and Apple devices. It's a free app that can help you learn the movement strategies for daily activities. There are tips for sleeping, self-grooming, sitting and standing posture, lifting and carrying, walking, reaching, going upstairs, and pushing. The glute strategy is also included in the app. They're not paying me to recommend this app. I just found it's a nice little educational tool to learn how to move and to get through daily life with the least amount of pain and the most amount of confidence. Thank you for sitting through this presentation with me. Please feel free to email or call me for questions or suggestions. I will be very glad to receive any feedback from you. Here's my resources of information if you want to read further.